Good day and welcome back. Dr. Scott, your online headache doc. Welcome back to Relief at Last. What your doctor won't tell you about your migraines, your headaches, and your pain. Today's question of the day. A friend suggested that I see her chiropractor for my migraines. What is your opinion? Results seem to vary. Well, you're exactly right. Not only do results vary drastically with chiropractic treatment for migraines, but results vary greatly with any kind of treatment for migraines. And here's the reason. We've discussed this time and time again, and that is each individual practitioner, healthcare provider, doctor, or specialist is only trained to see your migraines through their limited scope of practice. And treatment that is recommended is virtually always the specific type of treatment it is that that particular provider is trained to provide. And again, we call those specialty goggles. Specialty goggles limit your ability to find significant long-lasting relief because of your healthcare provider's limitations. So, particularly when it comes to chiropractic treatment, here's an insider's secret. Most chiropractors are trained and are proficient in one or maybe two particular methods or techniques of chiropractic adjustment or spinal manipulation, and the vast majority, if not all of their patients, receive the exact same technique or method of treatment. And here's the problem with that. It doesn't make any sense to me that each and every patient in your office receives the same method of treatment, because obviously our problems are unique. So, in the chiropractic profession as a whole, one of the quote-unquote dirty little secrets is if you visit 8, 10, a dozen different chiropractors, you may very well receive a different method or type of treatment at each and every provider's office. So, as of my last research, there are hundreds upon hundreds of different methods or techniques of chiropractic spinal adjustment. So, how do we know if you did decide or if you have visited a chiropractor for your migraines? Why is it that the results are so unpredictable? Well, let me say this first. In my more than 31 years in private practice, specializing exclusively 100% in migraine and headache disorders, about 55%, more than half of the people that visit my office for the first time, have undergone some kind of chiropractic treatment. And most all of the time with failing results, possibly a bit of temporary relief at best. And again, one of those reasons is the chiropractor, just as with any healthcare provider, your primary care doctor, the neurologist, the pain specialist, the physical therapist, the chiropractor, we're all trained in doctor's school to evaluate your migraines through our limited scope of practice and then provide whatever particular type of treatment it is that we so happen to be trained to provide. Huge mistake. So, my philosophy is simply this. We must take a step back, and your migraine specialist must be able to look at your condition from a much broader perspective, from the perspective of different specialties, not just from the particular type of specialty that they so happen to be trained to provide. Because again, there is no such thing as a magic pill, shot, potion, gadget, gizmo that's going to help 100% of the cases. It just doesn't happen in any method of healthcare. Again, I call this commonsensical medicine. Let's not give everybody the same type of treatment. Let's not give everybody the same category or classification of medication. Let's not give everybody the same spinal adjustment. Let's not give everybody the same therapy exercise. Let's take a look from a multi-specialty approach and evaluate your migraines from a multi-specialty approach. Then, and only when, the true cause of your migraine symptoms is pinpointed with certainty, can an effective treatment plan be put into place and personalized and customized specifically for you that will actually address the cause once and for all. And this is the simple reason that I was passed as a migraine sufferer for many years from doctor to doctor, specialist to specialist, neurology, chiropractic treatment at multiple locations with multiple healthcare providers, and still continued to have worsening migraine symptoms, happening more frequently and more severely. And again, common sense tells us that you must understand and you must pinpoint the real, true cause of your migraine symptoms first and foremost, then consult a specialist, a multi-specialty migraine provider that will actually personalize a plan to address the true cause once and for all. Look, our results successfully helping thousands of people since early 1993 are not a coincidence. It's by using the commonsensical approach. Please let me know if I can be of help to you, to someone you care about, and share this podcast with them. Thanks for listening. Next week, we're going to discuss some of the biggest mistakes that you're currently making and the reason you're not able to find significant long-lasting relief. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another opinion. The information contained in this podcast is for informational purposes only and is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's personal experience battling debilitating migraines for years, as well as his more than 31 years in private practice, specializing exclusively in migraine, headache, and chronic pain disorders. Copyright 2024 by Milagros Media, LLC.